Hello, everyone. Thank you so much for hopping on. My name is Ransom Onima. I'm a really good student and medical writer and also a content creator. So, today I have an amazing guest speaker, um, Dr. Kristie, an optometrist. So I'll give her the floors to introduce herself. So, Dr. Kristie, could you introduce yourself to the audience?
Sure. Hi, my name is Dr. Kristie Nguyen. I've been practicing for 18 years in the US as an optometrist. I started my career off as an independent contractor, basically working for other doctors. And only in the last 2 years did I actually ventured out and picked up my own lease. So now I actually have a home where I would see established patients back.
Amazing, amazing. So, Dr. Christie, we have a couple of questions for you to answer. You ready?
Yes.
All right. So, the first question goes this way. So, tell the audience, right? What really led you to specialize in eye care, and what do you find the most satisfying in your career? Talk us there.
Well, so what I love about the eye care industry is that I'm able to instantly give patients clear vision, whether it be through glasses or contact lenses. I do enjoy specialty fit contact lenses more on the multifocal side because that's where most patients struggle with their distance as well as near vision or the combination. Um, and I just find the job very rewarding.
Okay, amazing. I just took the line. Sorry. So, amazing. So, okay, so tell us, what is the difference between, if I proceed to the next question, tell us, Dr. Christie, what is the difference between an ophthalmologist and an optometrist? What is the difference?
So in the US, the difference between an ophthalmologist and optometrist is where they went to school. An ophthalmologist went to medical school first, then they got the residency in ophthalmology, and they basically focused more on the surgical side of eye care. Versus optometrists in the United States attend an optometry school within the first 4 years. Then they have an elective 1 year of residency where they can specialize, but we are more of your general care practitioner of eyes. So we don't elect to do surgeries unless in some states where there is a lack of ophthalmologists. There's some optometrists that are able to become licensed to do like cataract surgery or even LASIK surgery. But for the most part, we prefer not to do the surgery. We just want to focus on the main primary care of eyes.
Mm. All right, so I believe that the audience now have enough clarity on the difference between an optometrist and an ophthalmologist. So thank you so much, Dr. Christie, for clearing us on those differences. And thank you so much for also talking us through about, what really led you to specialize in eye care and what you find most satisfying about your work. So the next question for you is, as a brand ambassador, how do you balance promoting products with maintaining trust and authenticity with your audience? Talk us through.
Sure. So as a brand ambassador, most of the things that I am working with is within the eye care industry. So it's only usually with brands that I stand behind or products that I believe in. If I can't believe in it, I can't promote it. And it does come across if I'm just selling a product versus me genuinely recommending it and to my network. So most of the products that
Mm,
I do recommend, I do really find value in them. So if I can find value in them, I want to share that goodness with my colleagues so that they too can obtain that value.
okay. All right. So, do, what kind of brands do you work with? Is it brands that sells products related to your specialization in optometry?
So I work with 2 or 3 brands that does eyewear itself. So if you are an independent office and you need independent eyewear lines that doesn't have to jump through hoops with the insurance, I do work with them. And they also are made for Asian fit bridges. So that's why I like working with them because they fit me. So if they fit me, they'll fit the
Mm,
majority of the clientele. Also, I work for a company that does like virtual frame try-ons. So a lot of opticals have glasses and they can't do all the sales in person. So the other option is basically to sell it online, so that the patients can access their business website and access their inventory without having to be in the store. And with the virtual try-on, it is, again, easier for patients to try on eyewear prior to coming in for their eye exam and save some time. I work with another company that basically helps promote like websites for optometrists, because we become physicians for eyes, but we don't know anything about building a website. So I do work with a company that basically help promotes that, so that they can help you with generating that website, promoting your website, and guiding you along that path. There's just so many. I am also currently working with a very large contact lens company promoting a new contact lens that's out in the market that's a weekly wear. So I'm super excited about that as well. So there's just so many different things within the eye care industry that we can help other people with. And one of the biggest one that I am with right now is the EHR software that has just recently been endorsed and by AOA themselves. It's a very big organization here in the U.S., and for them to have that back support is amazing. And again, all of us are going from paper chart to electronic medical record keeping. So having a company that is, advancing and offering all these new high-tech options, going to make our job a lot easier, so we can concentrate on patient care and less on paperwork.
Yeah, I love that. Thank you so much, Dr. Kristie, for taking us through and how as a brand ambassador, how you balance, promoting products with maintaining trust and authenticity with your audiences. So makes me to proceed to the next question for you, Dr. Kristie. So tell us, can you share some common eye health myths that you often encounter in your practice, Dr. Stern?
Wait, myth. All
Yeah.
right. So myth about eye care in general. There's
Mm-hmm.
quite a few. So for me personally, a lot of patients complain about their contact lens rolling in the back of their eyes, which can't happen because the conjunctiva again kind of loops back around. So the contact lens can never get disappear in the back of your eyeballs. It's important to get your eye health check as well as just getting your vision check. So just because you see good doesn't mean your eyes are healthy. Your eyes is the window to your body. So a lot of times we find systemic health issues in your eyes that your body is not telling you yet. So that's why we work hand in hand with your primary care physician to let them know if there is an issue that arises, so that we can better care for you in general. Because if your body's doing healthy, and so will your eyes. So for anyone who's had LASIK done before, doesn't mean that they are no longer in need of having an eye checkup, because chances are they went in to get LASIK because they had poor vision to begin with. Usually those are your very high myopic patients. So myopia, again, can be early precursors for early cataracts, early glaucoma, retinal detachment. So again, all those things are still risk factors even after LASIK, because your eye anatomy is still of somebody who's myopic. So just at the top.
Yeah, amazing. That is a question that came to my mind. Do contact lens expire? Does it expire
Yes,
in
there is an expiration
years?
date. Again, when the product is made, there is an expiration date on the package, because that's going to be the max lifetime of where the contact lens will give you the best oxygen to your eyes while you are using it. So after the expiration date, it is best not to use it, because you can run in the risk that there could be contamination after that, or even the fact that it may not offer the max amount of oxygen so your eyes can breathe.
Thank you so much for talking us through about that, Dr. Kristie. So that makes me to go to the next question to you. So how do you stay motivated and spread positivity in your daily life and career, Dr. Stern?
So I don't know about other people, but for myself, I am Christian based. So I believe that, if God deems it worthy, I will follow in his path. This has been my calling since junior high when I prayed about it. He put it in my mind that, I can be like him by serving others, curing the blind, and in my case, without surgery. So I am just doing what I am passionate about, which is again living the life that I feel God has led me to. And by doing so, I cannot worry about things that I shouldn't be worrying about. I just need to show up, take care of my patients, help them see. And in terms that makes me happy. So then if I'm happy, I like to spread that happiness to other people as well.
Mm, mm. So I amazing that you're a Christian, same as I am. But because I believe that during your practice as an optometrist, there's some patients you meet that doesn't equate with your belief systems, right? So
Mhm.
how do you work with patients that don't really believe in what you believe in?
So just
How does it work?
So just because they don't believe in God doesn't mean they don't believe in their well-being or their happiness. Because again, God doesn't put a definition on your faith or how you should live your life. So I feel that if
Mm,
I like to treat people the way I want to be treated, so that's how I conduct my exams. I conduct it from a patient's perspective. How would I, as a patient, want my doctor to communicate with me during the exam? So I do a lot of
mm,
explanation, a lot of visuals during my exam to make sure that my patient are well educated about their eye health. In that term, that we build trust, and we joke in the exam room. We don't make it super serious, and so that they know they can come to me if they have any questions or concerns, and I will not be judging them because I don't want to be judged if I was in their shoes. So
yeah, absolutely, absolutely. Thank you so much for talking to Stu about how you stay motivated, and spread positivity in your daily life and career. So the next question is, what advice would you give to people struggling to maintain in your business?
so
Tell us,
my
sir.
to people would be to network. So you just never know who you come across who may be somehow benefit you in the future by connecting you with somebody. So it may not be them directly, but maybe somebody that they know. So you always want to make sure you're nice to people and you talk to them and get to know them as a person, not try to sell them a product or a service or anything like that, but really just get to know somebody and see how you can help them. So again, you want to serve others, and in terms, they will serve you back. And by building those bonds, it will lead to further opportunities further down the line. It may not be today, it may not be tomorrow, but it could be years from now, where that one relationship can help connect you to somebody else. So, I mean, I have a great story about that if you have time to hear it.
Yeah, 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 you're free. You're free to cheer. The audience would love
So I
to
worked
hear
with
it.
this esthetician years ago, over 10 years ago at this other practice. I think she was new out of school at that time. We recently just connected on LinkedIn, and she was telling me how her health has been declining and that she is looking for some new opportunities. Well, I met somebody at one of these events I do um, months ago, but he has something that is like a traveling opticianary. And so I connected the two of them together. And then she goes, "Yes, Dr. Kristie, it was great working with you years ago. And I know you may not remember me, but we did work together." And I'm looking at her profile going, "But she lives in Massachusetts now. Like I'm in Florida. Like how do we ever connect?" But if I look back at her history, when she first worked out, she was actually in Orlando. So then I have like, I thought it was this one office, but it was at another office. So again, because she knew me and we worked together, we reconnected. Over 10 years from now, I was able to connect her with somebody else that I know, and we'll see where that
Mm,
conversation leads. It may be the next opportunity that she's looking for.
amazing, amazing. I think that's a little disclaimer for other, audiences out there. It's also to be on LinkedIn though, because LinkedIn is an amazing
It is
platform where you
a great
can
platform for networking.
amazing, amazing. LinkedIn is a good like is all the way. It's preferable for other platforms as well. So Dr. Christie, thank you so much for giving us such an amazing advice for people struggling to maintain good health in their busy lives. So the last question for you is, what are some simple tips that everyone should know to maintain health? What do you have to say about that?
super easy. So first thing first, wear your sunglasses. So easy, so simple, but it protects your eye health from the front all the way to the very back. So you're preventing skin cancers around the eyes. You're preventing pinguecula and pterygiums around the eyes. You're preventing cataracts behind your lens. You're preventing macular degeneration in the back. So simple, but it also helps prevent fine lines and wrinkles around your eyes too. Second thing, make sure you're eating healthy and you're working out, because if your body's not healthy, again, it shows up in the back of your eyes or around your eyes or in front of your eyes. So I let patients know, like I said, when your body's not healthy, it shows. And sometimes it shows in the weirdest way. And I get to see and evaluate that when you come in for your exams. So if you don't come for your exams, I won't be able to see any of that. And if your doctor prescribed glasses, don't complain you can't see if you're not wearing them. Wear your glasses. That's what they're there for. So when people tell me, oh, I can't see, I say, do you have glasses? Yeah. Do you use them? No. I say, well, that doesn't make sense. If you have glasses, why are you not using them? If it's not up to date, then get them up to date. So it's just simple things like that.
Amazing, amazing. Dr. Kristie, thank you so much for your time because I know you're a very, very busy person. So I we the people and the audience are really, appreciating your narrative and these questions, and I believe that the audience will really enlighten more. So if you love this content, do out to like, share, and subscribe. And if you have questions about things related to eye care, eye health, or whatever, I believe Dr. Christie will be able to answer them. And if you want to connect with Dr. Christie on LinkedIn or on Instagram, we're going to put all the details on YouTube description below. So thank you, everyone. Thank you so much, Dr. Christie. You're the
Thank
best.
you.
All right, just 1 minute.